speaking with Dr. Khalid Ajib, a urologic surgeon at Albany Urology Clinic and Surgery Center, about the importance of prostate screenings for men. So welcome to Town and Country. How are you doing
Thank you so much for having me today.
Absolutely,
Thank you.
absolutely. So
it's my pleasure.
I was told that November is known for something called Movember?
That's right,
yes. So
yes.
what does that mean?
Yes.
You got to break that down
yes,
for us.
so November is not just the month of Thanksgiving.
Yeah.
November is like a global movement where usually men grow mustaches to kind of spread awareness about men's health, especially like diseases like prostate cancer, testicular cancer, and even mental health.
Yeah.
So it's kind of encouraging men to take better care of their own health.
I love that.
Yes,
so they got everything for November.
That's right.
I mean, I've heard of no shave November for the men. I mean, the men are just doing it up.
That's doing it all right.
Yeah. Now let's start with the big picture of
yes.
prostate cancer. How prevalent is it in the United States?
Yes, so prostate cancer is quite common. So besides from skin cancer, it's the most common cancer that affects men in the US.
Okay.
And it is the second leading cause of cancer-related death, right behind lung cancer.
Wow.
So the incidence is like 1 in 8 men will be diagnosed with prostate cancer at some point in their lifetime. And we had several like autopsy studies that do show that the percentage can be as high as 60% in men above the age of 70.
Okay.
So it is quite common.
Yeah.
Yes.
What about
yes.
in Georgia? Is that the same?
So Georgia, it like compared to other US states, it ranks 5th in regards to the incidence of prostate cancer.
Okay.
And in regards to cancer, like prostate cancer related deaths, it ranks 8th.
Okay.
Yes.
Now, is it any difference when it comes to ethnicities?
That's true, that's right. So yes, there is an increased incidence in African Americans. The incidence can be as high as in 1 in 6 men. That's compared to 1 in 8, as I said like a while ago. And several studies did show that whenever African American men are diagnosed with prostate cancer, it's usually a higher stage of prostate cancer, and this is mainly related to some genetic factors.
Okay.
Yes.
Do you think, and I like to ask any doctor, do you think that diet plays a role in any of this?
Not really. Like in prostate cancer, it wasn't like scientifically proven that it does increase or reduce the risk of prostate cancer at this time.
Okay.
Yes.
Let's talk about the screenings. What are the current recommendations?
Yes. So screening is very important, not just in prostate cancer. It's like testing for a disease when you have no symptoms. And in prostate cancer, usually the American Cancer Society does recommend screening for men above the age of 50. So every man above the age of 50 should discuss that with a urologist or primary care physician. And it's even recommended at younger ages, at the age of 45 in African Americans and men with strong family history.
Okay.
Yes.
So what does a screening for prostate cancer consist of? What does that look like? Let's paint the picture for the man out there.
Yes, it's a very simple blood test. It's a very simple blood test called the PSA blood test, which is a protein secreted by the prostate, and we're usually looking for elevated levels. Now, also we're fortunate, like at the office, to offer other tumor markers that we have available nowadays that can also help us establish a diagnosis. And also, we also sometimes recommend to do an MRI of the prostate, which is a specific image that will study the size of the prostate, and we look for like suspicious lesions in the prostate. And what's also really important is genetic testing, because it was shown that men who carry the BRCA gene, the BRCA gene, are at a higher risk of getting prostate cancer. So we test for that too. And that's, by the way, that's the same gene that increases the risk of breast cancer in women.
Wow.
Yes.
Okay.
Yes.
Wow. Learning
So
much.
yes.
I love it.
Yes,
all right. Now let's talk about the good things. The treatment. How can we get treated for prostate cancer?
That's right. Yes. So first of all, like again, when we see that a patient has a high PSA, we do a prostate biopsy, which is a very quick procedure. And if we have the diagnosis of prostate cancer, we have several treatment options.
Okay.
It depends on the stage of that prostate cancer. So we have active surveillance in low-risk cases where we just monitor the patient closely with blood tests and imaging. We also offer robotic-assisted radical prostatectomy, which is the removal of the prostate.
Okay.
Other treatment options can include radiation therapy or hormonal therapy. And what's very important that here in Albany, we do offer, like at the office, we do offer all standard of care treatment options. So you have everything is available here in Albany.
Perfect. Yes. Now, I want to go back a little bit because I wasn't able to ask you about the symptoms.
Yes.
What are the symptoms usually for men?
So usually in prostate cancer, men present without any symptom.
Wow.
So that's why prostate cancer screening is very important. Usually, unless it's a very aggressive stage, that's when they will have some symptoms. But otherwise, they present with no symptoms at all.
Okay. Okay.
Yes.
And now, is prostate cancer the most common pathology affecting the prostate?
Usually, no. It's BPH, which is the benign enlargement of the prostate. That's the most common pathology affecting men above the age of 50, and mainly due to certain hormonal imbalances where the prostate will just continue to grow and can cause some urinary symptoms.
Okay. And so when should men get screened? Now?
So for prostate, right, again, as I mentioned, any man above the age of 50 should just get in touch with his urologist or primary care physician to discuss prostate cancer screening.
Okay, gotcha.
Yes.
All right, and then if they want to schedule an appointment with you, how can they get in touch with you?
So it's super easy. They do not need any referrals. They can just give us a call at the office, and we'll be more than happy to help anyone with any urinary issue or to discuss prostate cancer screening.
All right, perfect. Well, thank you so much. That
was
very insightful.
It was a pleasure to be here today.
Absolutely.
And just want to tell, us at Albany Urology, we're always going to be committed to serve the community here in Albany and South Georgia.
Absolutely, and it's right here in the Good Life City.
That's
so again,
right.
thank you so much.
Thank you so
Dr.
much. Thank you for having me today.
Of course, and I'll make sure I have all his information posted on our website at walb.com. But don't go just yet. Coming up after the break, if you're getting ready